Hello, and welcome to the Salford Human Movement and Rehabilitation Research Group launch event. My name is Ben Griffiths. I'm a postdoctorate researcher here at the University of Salford, and I'm going to be chairing the session along with my colleague, Michael Prince. So this is the third session in our week-long research group launch event. Still to come this week, we have clinical demands and mobility in health, which is going to be tomorrow morning at the same time. And then on Friday, we have our premier event, the balloon debate. We'll be providing more information on these events at the end of the session. So as I said, this is the third session in our week-long launch event. This session is titled Understanding Real-World Physical Behaviours. And you've got a real treat today. We've got a great lineup of speakers. A little bit of housekeeping at the head of this session. If you have any questions for the speakers, please leave them in the chat box. And at the end of each presentation, we'll direct these to the speakers. So without further ado, I'll kick things off and introduce you to our keynote, Andreas Holtermann. Andreas is a professor at the National Research Centre for the Working Environment in Copenhagen, Denmark. Andreas's research is mainly focused on workplace physical activity, proposing the concept of the physical activity paradox. He is also a key founding member of the Perspective of Physical Activity, Sitting and Sleep Consortium, an international research collaboration platform of cohorts using thigh-worn accelerometry data to understand health outcomes. Andreas is known to be a captivating and passionate speaker, so you're in for a real treat today. So I'll hand you over to Andreas now, and he's going to talk to us about how to retrieve valid, understandable, low-cost and low-burden measurements of physical behavior on the many.
Thank you for the introduction. I'm very pleased and happy to be able to and allowed to give this talk today. As said, my name is Andreas Holtermann, and I'm having a background in human movement science. And as a human movement scientist, I have a strong belief in the potential and power of integrating the different scientific fields around physical behaviors. So trying to make a good collaboration between those interested in exercise science, exercise medicine, occupational health, public health, rehabilitation science, technology developments. And I think this is what I understand you are doing, trying to integrate and strengthen the collaboration between these fields. And I think it's wonderful. I wished I could be there and visit you, but I hope I will be able to do that another time. So I will be talking about the importance, not only about valid measurements of physical behaviors, everyone knows that, but I think what we really need is to have understandable information of physical behaviors, which can be used across all these different disciplines and fields, which I mentioned, and for different purposes. So both for cohorts, in respect to surveillance, interventions, rehabilitation settings. And I think this is one of the things which I've been understanding more and more of while I moved from the human movement science to the occupational health field. And I think this can be exemplified by the most important topic at the election in Denmark last year. It was about physical behavior during normal, real life of normal people. It was about that we are increasing the retirement age in Denmark. And the huge discussion was about should the increasing retirement age, which was 65 last year, now it's 66, and will be just steady increasing until probably 72 or more in the future. The question was, should it be differentiated between different jobs having different type of physical behaviors? Can the workers have the ability, capacity, and can we rehabilitate the workers back to work if they are having a work in, for instance, in production lines, standing for 6 hours, if they are having a work in elder care where they are on their feet all the time, or have they other kind of sedentary work, which having an increased risk for obesity and other type of issues. And this was the main topic. And what the politicians and policymakers said that we need more understandable, valid information of real-world behaviors of normal people. And last week, I think in Denmark we call them the wise men, the president of the wise men in economics in Denmark said that the most important factor for the economy of Denmark in the future is to be able to keep the lower socioeconomic groups healthy at work until a long time, where the behaviors, both the behaviors what they need to do in the work, but also the behaviors to keep healthy and fit are essential. And this came from the economic wise men. And I think this just gives an example of the importance of us researchers being able to both measure, but of course also use measurements of physical behaviors in a way that policymakers can understand. And in 2008 and 2009, I started to try to figure out which type of measurement devices which were available at that time, which could provide not only valid, but also understandable information about physical behaviors of normal people during normal daily life. And several of these measurements provided information about, accelerometer counts per minute, or all kind of measurements about energy expenditure, intensity, and so on. And then in the beginning, in 2008, I tried to show this for instance, to the social partners, to the work environment authority, to occupational medicine, but they didn't understand anything of it. What is these kind of measures? They are used to measures of what normal people are doing throughout the normal day, which is how much do they sit, how much do they stand, how much do they walk, can they do different functional tasks in their normal daily life. And this is what has been in Denmark since 1990. We have every second year sent out to 50,000 people questionnaires about this information. And the reason for this is that it's the most important predictors for sickness absence, for early retirement, for different diseases, which is crucial for policy and for our economy. The problem is that the policymakers also know it, that these type of questionnaires are not that valid. For instance, we did this study on sitting time, where we have a questionnaire about how much are you sitting throughout the day, and then we did a measurement, accelerometer-based measurements about sitting. And then you can see in the horizontal line, you see the numbers of minutes of sitting on average based on the questionnaire and accelerometer. And on the y-axis, you can see that on average, these were blue-collar workers. They were underreporting their sitting time with 200 minutes per day. So the policymakers have understood that while these type of questionnaires are not sufficient as a valid source of information for behaviors. And for that reason, in 2009, we started to develop a software system strongly inspired by ActivePath about 5-word accelerometry, developing very simplistic decision tree models where we could develop a model finding very high sensitivity and specificity for normal daily physical behaviors, how much people are sitting, standing, walking, running, doing stair climbing, cycling, and so on. And then we got some kind of information which we showed in 2010 to policymakers, which made them actually understand how a day can look like. And this is just an example of myself. In the upper figure, you can see my work time. And here you can see from the early morning at 7 a.m. You can see that I'm generally sitting, then I'm doing some bouts of walking throughout the day. And you can see at 12 o'clock, then 12:30, I'm actually cycling to another meeting. But in general, I'm sitting 82% of my working time. While during leisure time, as you can see in the figure below, I'm having a completely different behaviors. Then you can see from 4 p.m. that I'm standing, and then I'm doing some cycling from home in Copenhagen. Then I actually go for some running, and then I did some walking and so on. And you can see my distribution looks very different. The main point is that these type of figures has been the most important tool I ever had for 12 years now to show policymakers how does a working day look like for different type of people in a way that the policymakers actually can understand it and grasp it, which is, I think, is crucial. Then we have been working, trying to harmonize this type of data based on physical activity monitoring based on the thigh from different cohorts globally, and this project called the SurPASS, which is going very well. We just got Mark Hamer just got a funding from the British Heart Association for this, so we are very much looking forward to the progress. But finally, it's still so hard to harmonize these type of measurement data of behaviors, even though we just limit it to accelerometry on the thigh, because cohorts have used different type of accelerometer brands, they use different type of software, different type of protocols, and so on and so forth. So we are really trying to push a harmonization, prospective harmonization of this. But in the bitter end, it's so difficult because the cost of running cohorts like this Hunt study, which we're running, it ended just before the COVID came, shows that the cost of doing thigh-worn accelerometry, they actually also did it on the back, on about 33,000 participants with full clinical measurements and so on. It's a huge burden, both with respect to research for the administrative research, researchers and practice doing this, but also for a participation burden. They have to go in to the clinic, get mounted with the accelerometer. They have to wear it for a long period of time. They also have to go back and deliver it or mail it back. So it's a huge cost, and it's so hard to do for countries not having this oil money as they have in Norway. So my vision for the last years has been, is it feasible to develop a monitoring system which provides valid information of physical behaviors, normal physical behaviors which people understand, with low participant burden, so easy to use, high hygiene, no sensor returning, with low administrative burden, so it should be cheap in cost, should be automated analytics and secure, and should require a low demand for expertise, to be used in large-scale surveillance and cohorts, but I also think in interventions and in practice and rehabilitation globally. Is this possible to develop? And we just got funding for this a couple of months ago, and we call this project SurPASS. So it's for developing this type of system for the surveillance purpose, but we also develop it so it can be in the future used for cohorts, but also for interventions, which we are also running. And the main ingredients of this system is that we are collaborating with a company which has developed an accelerometer, very cheap accelerometer system with a patch system which is very easy by the participants themselves to put on. Then this accelerometer can monitor for 3 months. You can take it off and on, of course. Then the signal from the accelerometry is sent in an encrypted, safe manner to the mobile phone, and then from the mobile phone and further up to the server, where the data is handled, secured, analyzed, and then sent back to the researcher, to the practitioners, or giving feedback to the participants. And we are now trying to develop this type of 8 steps process in this SurPASS system. So hopefully we can succeed to have, so when the participants say, yes, I would like to participate in step 1, then we will mail the accelerometry system to them by post. Then the participants should be able to attach the system themselves, download an app where the accelerometry for at least 1 week, hopefully much longer. Then the data will be automatically transferred in a encrypted, safe manner from the accelerometer to the phone up to the server, where we are then analyzing it in step 6 and providing afterwards feedback to the participants, but also to the researcher, or if it's a rehabilitation or intervention setting, then we'll of course also provide information to the practitioner or to the clinicians. And the end, we have the possibility then to link this information with different registers in Denmark. So what we are working on now is to try to develop this type of system with the vision that we can actually have a cheap system which can be used for all kind of measurement devices globally, without having a necessity of a huge resources and putting a high burden on the participants. Thank you.
Hi, Andreas. Thank you very much for that presentation. That was really interesting. I've got a couple of questions for you here. So I'm just wondering, this equipment sounds really interesting. But how do we use this information we collect to create a change in individuals' behaviors? And then also, how can we use the same equipment to actually capture if this change has had an effect?
Yeah, so an example is so this system is already developed for instance, in a patient setting in hospitals, where the nurses are putting the accelerometry on a patient, and where they have the goals of both goals to prevent wounds by lying on one side for long periods of time, that the patient should be turned around in the bed, but the patient should also have a goal for how many steps, or if they should walk in the stairs every day. So this is done by the nurses putting on the accelerometry on the patient. The data is sent automatically via up to the server, analyzed, and back to on a screen for the nurse. So the nurse can follow every day, or when they're coming to work, how many steps have the patient walked, what was the goal, how much steps have the patient walked, and then can follow if they are actually been fulfilling this goal. So this is just a way which the system is already shown to be effective in a hospital setting. And I hope that this can be used in a lot of different settings, because if you can succeed to provide this type of information and target it so closely to what is the goal of the behavior change, and then provide information both to the clinician, to the practitioner, and to the patient or person, I think it might be very useful in a lot of different settings.
Okay, thanks for that. We've also got a question here from Malcolm Granite. So he said, you have understandable outcomes to policymakers. So things like total time, sitting, standing, etc. They're understandable patterning of activities. Sorry, how do you understand the patterns of these activities, such as cadence and things like that, that might in fact be more important, and how can you make these outcomes more understandable?
Yeah, that's actually it's exactly what I'm doing. Last day I was only about this. So the larger worker union asked me, how can it be that those working in elderly care, which is, I think we have a huge problem in Denmark to have sufficient amount of workforce in the elderly care, and it's just increasing. How can it be that the workers are just so fatigued, have so much pain, so much low fitness when they are walking all the time? and they are asking me, how can you provide this type of information to us so we can go further to policymakers and really change this? I'm actually now sitting and making a lot of different figures and trying to describe it in a way that, well, for instance, what is a balance today? What is a balance between which type of physical activity you're doing, the intensity you're doing, and the amount of rest? What is a balance during your working hours, during your 24 hours? And I think this is so crucial. But what they are saying is that forget about a lot of academic wordings and all this sort of thing. You need to illustrate it to us so we understand it in a way that we understand. So I think this is one of the key points which we need to work on, is about how to visualize and make constructs which normal people without any academic background in physical behaviors and health can understand and act upon.
Yeah, thank you very much. I think it's a really challenging thing, something that I've come across in my research. I've got one more question for you, and this is sort of a bit left field, but I'm wondering, do you think it's more important to capture individuals' physical activities or capture their sedentary behavior when you're thinking of health outcomes?
Oh, great question. I think it's not about one or the other. In the future, or very close to the future, it's about not only looking about what is the effect of one behavior independent of the other. We know that the body doesn't work like that. The physiological responses is not from one single behavior independent of the others. It is what you are doing during of behaviors throughout the day. So let's say that sitting time, which most of us I think that, well, in general it should just be minimized. Well, in general, what we see in different occupation groups, that for instance those working in production lines, static standing for 8 hours, they are in need of more sitting. So our complete understanding of the effects of behaviors need to take all the behaviors throughout a day into account. So what I think we need to do in the future is to say, well, you have a 24-hour profile of behaviors during this day. How does that affect your health? And how should you change the profile of your behaviors depending on which status you have now, your current profile? And I think that's a huge. I think it's a huge challenge for our field to be able to do that. But I think this is also one of the things which is necessary to be able to generate a mutual understanding between exercise science, exercise medicine, rehabilitation science, occupational health, because I think in the end we can agree upon, well, what should these profiles of behaviors look like to be healthy, instead of just focusing on different things.
Thank you very much, Andreas. That's really interesting. Unfortunately, we're going to have to wrap it up there and move on to our next speaker, but thank you very much for your talk.